Hello, and welcome back to another episode of Mona's Rants. I am your host, Mona Sheikh. You guys, what is happening? I am very excited about my guest today. We're going to get to it, mainly because the topic is very hot, and it is a very sad and dire thing, but the COVID cases in India are absolutely ridiculous. India today reached 20 million COVID cases. 20 million. They have about 120 people dying about every hour, according to CBS News. And I wanted to bring back my amazing guest that I've had in the past. He is a professor at the Center for Global Infectious Disease Research at Seattle's Children's Hospital. Here's the amazing Don Sodora. How are you?
Hi, good. How are you?
I'm good. Thank you for being here again. I wanna jump into this, Don. Don, how bad is it in India right now?
Yeah, I think you summed it up pretty well. It's so the number of infections per day is higher than any other country, including our highest numbers. So they're up to 400,000 people infected a day. And the number of deaths is terrible, mostly because they're running out of oxygen and they're running out of space in their hospitals, running out of medicine, and people are on the street waiting to get into the hospitals. Those pictures are all online if anybody wants to see them. It's just a dire situation. That's
right.
I don't know that much about the politics or about all the different decisions they made as a country that led to this, but there was a bunch of issues with regard to their decisions and the government. And again, we could talk a little bit about it because I know a little bit, but hopefully, maybe a little more than I do. It's really bad.
Don, I was reading one of the quotes from the doctor at the Balta Hospital in Delhi, and the quote that he gave was so incredibly heartbreaking. And I'll read you the quote. The quote goes, "I don't know who is running this country." In other words, these are doctors. These are people who are going out and, who are trying to save people's lives. They're saying, basically, almost to them, it feels like the country is on automatic pilot, which, let's be real, we were also there not too long ago, right? And thank God, because God took mercy on us, and thank God for extra 5 million votes. We got Biden, and now, things are under control. At least we're trying to get under control. I want to talk a little bit about this herd immunity issue that the experts just came out and said this week that we are not going to be able to achieve it by this fall in America. And then I want to go back to India. What are your thoughts on that? For some people are offended by herd immunity comment. They want to call it community immunity, and however you want to phrase it. So let's go with community immunity. Why are experts saying that we're not going to be able to reach community immunity?
They're concerned on a number of different fronts. When Fauci was first trying to put a number to this back in the summer, June, I guess the first time I remember him trying to put a number, and I think the first number he put was 70%.
Yeah. Don, I think Don's feed is stuck. Let's see if we can bring Don. Can you hear us? Don, can you hear me? Hello? Ah, lovely internet. Don't you love it? Let's see if we can bring our friend Don back in here. Don Sodora, can you hear us? Well, while we wait for Don to come on, James is here. Happy Tuesday, everybody. Happy Tuesday, James. Waiting for my friend Don to come back in. I think he's gonna log back in. You guys, if you guys didn't hear the conversation we're having today, we're talking. Oh, you hear me right? Thank you, Andre. Appreciate it. We're talking about the spiking, horrific cases in India, and I brought on our professor, who's an infectious disease professor expert at the Seattle Children's Hospital. We lost connection. He's trying to get back in, but I don't know if you heard, but India has had 20 million cases thus far, and they're having about 120 people die every hour. That is the number that we're getting that I saw on CBS News. They're running out of oxygen. There are deaths happening left and right. They are literally burning bodies all day just to keep up with the situation. And I was pointing out that one of the doctors in Delhi, Delhi's Batra Hospital, the chief of the hospital, came out and said on oxygen deaths, he said, I don't know who is running this country. In other words, implying that the government of India is not doing anything. I've said this before and I'll say it. Modi is worse than Trump. Not too long ago, America was in a situation where we were having deaths taking place left and right. And there was a spike in cases because we had a horrific government in place that didn't care for its people. And thank God that has been a shift. So thank God for Biden. However, Modi is absolutely Modi is Trump on acid. That's what Modi is. And besides making it a political statement, we're talking, just look at the number of deaths, right? If you genuinely give a shit about your country and if you genuinely give a shit about your people, would you not want to provide them oxygen tanks? There is a big controversy happening in Delhi right now, besides all, of course, the horrific thing that our Indian brothers and sisters are struggling in India. Modi and his folks want to build a $2 billion residency in the middle of a pandemic while people are dying left and right. So, of course, people are coming out and shouting and saying, hey, people are dying left and right. Shouldn't you take that money and invest it in getting oxygen tanks and, help the people out who are dying? And their response is nothing. So, when the chief of a hospital comes out and says that who's running this country, that means nobody's running that country. That's what that means. It almost feels like Modi is letting the COVID just run through India and just has as many people die as it possibly can, because as long as it doesn't affect him and his cronies, he is all good. And that is highly disturbing, you guys. Modi is the leader of the largest democracy in the world. So how could it be that here we are where our Indian brothers and sisters are dying left and right and its government is not doing anything? All right, we got Don Sodora back here. Don, can you hear us?
Yeah, I'm so sorry.
That's okay. That's all right. That's technology.
My
sorry.
Computer.
That's okay.
So I was talking about herd immunity. So Fauci, he first said 70%, and then he went to 80% in August. And I think that the number itself is so hard to define because there's so many factors that influence it. So what herd immunity is a number at which, if you get that percentage of the population vaccinated, then basically you can prevent further future infections. In other words, it's like if somebody that can get infected is surrounded by people that cannot be infected, the virus can't get to them. So it's like a protective bubble. And how many people do you need to get so that everybody who's not vaccinated can have a protective bubble? And that number is so hard to decide. And by having a number, I think I think they felt like it was giving the people that didn't want to get vaccinated kind of like an out. It's like, well, if they only need 80%, then, and I don't want to get vaccinated, I just won't get vaccinated. So, right. So, and I think there was a number of different reasons why they started deciding to just stop having a conversation with regard to that there being a number, and just having the concept that you need to get as many people vaccinated as you possibly can. And that's the way to actually get the country back on track and everybody working and you back in the comedy shops and whatnot.
We're talking about what? We're talking about what? 80% immunity? 80% of the population needs to be vaccinated? Is that what we're talking about, Don?
I mean, again, it's so hard to put a number to it because it's like once you say a number, then people kind of...
Right.
Yeah, but I think if we did have 80%, it would not surprise me if that was the number in which you started seeing the caseload going so low Like, look how good California's doing, right? I mean, they had 0 deaths in Los Angeles County
Amazing.
yesterday, I think, right?
Yeah. Yep.
And so, how did they accomplish that, right? They're just it's using masking, it's social distancing, it's vaccination, it's getting people so they know what to do, and all of a sudden you get the case number so low that the number of deaths goes to 0 on a single day. I mean, it's not 0,
Right.
I mean, obviously there could be people dying today, a few, but it's amazing, right? And that's what that's what the country needs to go towards. So I would, if you want me to give a number, I mean, 80% is like a standard number people talk about, but it may be higher. It's hard to know.
Right. What happens if we don't reach community immunity? What happens?
Then the virus just keeps it keeps percolating, keeps infecting. Like, it'll find different groups. And so what imagine that now it can infect this little group of people, and one of those people goes and decides to take a drive when he's or she's infected, and they go to another little group of people that are infectable, and it just keeps going, and then it can mutate, which is what's happening in India now. There's so many people infected that you start seeing mutations, and then you worry that the mutations are going to actually be mutations that either make the virus really super easy to transmit, which we're seeing some of, or even worse, if the mutations lead to a virus that with a vaccine doesn't protect you any longer. That's a huge concern. We haven't seen that yet, but we're really worried that that's going to happen. And so you want to keep the number of infections down as low as possible.
I mean, Biden just came out and said, of course, we're trying to provide as much, as much help as you can with oxygen and medicine. And there's even talks about AstraZeneca and Johnson & Johnson, being sent to India to be like, at least let's start getting people vaccinated, at least get some kind of vaccination in, folks, so we can start lowering the number of deaths and the number of infections. However, Biden has also come out and said that he's going to basically limit or even ban the amount of people coming in from India, so we don't again have a spike, or or if there's a mutation that's occurred, then there we have a mutated strain that's going to come in. What are your thoughts on that, Don? I mean, how first of all, is there proof that there is a mutated strain, and second, how much of the odds are there of the strain coming here and then spiking our cases back up again?
The proof that there's there's a strain going around right now that they're calling the double mutant, which is not it's kind of a misnomer in that it just has 2 mutations that are found in 2 other variants, one from the UK and one from, I can't remember, New York, I think. And it just happens to have both of these mutations. It's unclear if having the 2 mutations together make it a more easily transmitted virus or not. It's unclear. Nobody's done the experiments to see what that means. So there is definitely mutations happening. Right now, it's unclear, again, how that translates into a worse virus. We just don't know. So precautions are necessary, I think. We've done a lot of travel restrictions on a lot of different places. Over and over again. I do not agree, or I did not agree with what Australia did, which was to prevent people that were even like Australians, citizens, from coming back to Australia.
Oh, wow.
I don't know that that's a smart move. I think you can have people return and quarantine and treat, vaccinate, and things like that you can do for them. But I'm not sure leaving them in India is a better solution.
Right. I mean, but then if you bring folks in who have the mutated strain rather, then we're jeopardizing, our well-being here, aren't we?
Mm-hmm. There's a chance of that. So you would have to have them, bring them in. You'd have to use really good public health measures and, testing, vaccination, treatment when necessary. You'd have to have them very carefully monitored. These are
Yeah.
all things that can be done.
Right.
Right.
I mean, if
It's not.
somebody's, yeah,
It is a risk. It's. You're right. There is a risk.
right. I mean,
Not,
if somebody's coming in from India, let's say, and they're infected, now they've been infected, they've been on whatever that 12, 13-hour flight is. Somebody on that flight is getting infected with that. Are they not? They have to be. They're breathing the same air. Even if they're circulating fresh air, as the airlines claim, you're still breathing the same. The person sitting next to you, you're breathing the same air.
Let's assume that the airlines have a policy where they are, and I know we do in the United States. I'm assuming India too. Policies you need to have a test before you get on a plane. And so imagine that I think the test needs to be within 48 hours or something, right? So somebody would have to test negative 48 hours prior to getting on the flight, which means that if they were infected, the viral load on the flight was probably low.
Okay. Probably. That is if they're doing that on Air India, whatever, whichever airline's coming in. Yeah.
I would be surprised if they're not, honestly. But I mean, but let's assume that they are. And if your viral load is very low, your chance of transmitting are very low. But once you land, the virus can start going up and up and up. And so 2 days after you land, or whatever, even day after you land, you could have lots and lots of virus in your nose, and you could be breathing it out and affecting the people around you in your home, which could then be going out and infecting other people.
That's right.
There's not a zero risk. But it can be monitored. It is something that can be done. But I don't think we should be doing any business flights or any tourist flight. I mean, only to retrieve people that are American citizens back to the States.
Right.
That's all we should be doing. Then nothing.
That's right. That's right. John, I'm sure you've been reading, all these these occurrences in India. They're talking about an oxygen shortage, right? That's a big thing. I know you shared a link with me where people can go and help out and donate to, help folks out in India, which I'm going to put that link up if people want to donate and help folks out. But how many lives? What is the percentage of lives that could be saved on oxygen tanks versus non-oxygen tanks?
Oh, it's huge, right? So basically, it's a disease of it's like your lung is unable to function properly, and your purpose of your lung is to get oxygen into your body. So if you only have a quarter of your lung working, you all you need to do is increase the amount of oxygen going in, and you can still have enough oxygen for your body to do well, right? But if you can't increase the oxygen, if you still have to breathe the amount of oxygen just in normal air, it's just not enough.
Right.
And ventilation is different, right? Ventilation is where they actually knock you out and they actually intubate you to give you to actually push the oxygen into your lungs. That's different thing, because even in this country, once you're intubated, if you have COVID and you're intubated, you have a relatively low prognosis for recovery, because last I heard it was 50-50, and maybe it's 75 chance of recovering now. It might be better, but they decided to just keep people off of ventilators and just give them oxygen, supplemental oxygen. They felt that was better.
Okay.
So they don't even really need ventilators as much as they need just oxygen to make a big difference in the recovery.
Right. Donna, this is a silly question, but I was watching all these bodies that are being burnt in India because they can't even keep them up. I mean, it's too much. India hits new grim record with 3,689 COVID-19 deaths in one day. So they're reaching almost 4,000 deaths a day. When they burn the bodies, does the virus die in the fire, or does it evaporate in the air and it's like, I'm good, kill this body, moving on to the next one? How does that work?
As far as I know, there's been no evidence that any virus can be transmitted via fire, smoke. or any
No.
other thing.
So
It's
once the body is burnt, like that's it,
Yeah.
the COVID dies with that.
Yeah, the virus needs living cells to actually survive. So even in a dead body, most viruses are actually, there's a few really important exceptions, but like Ebola is a huge exception. If you're somebody who's died of Ebola, they can still transmit the virus. That's that's one of the things that was happening at the funerals. People were touching the bodies and then getting Ebola. Or I think one of the practices was to wash the body, and that was huge. They had to stop that. So other than that, which is washing, which is different than fire. No, fire, I think for no matter what the virus is, it would be unable to transmit.
It's not going to be able to survive. Don, even with all the help that India is getting, which is so sad that the Indian government itself is just like, they're just sitting on their chunky little asses and just not doing anything to help their own folks out, which is really sad. However, all the assistance that they're getting from America and other parts of the world, I mean, given the current situation at the rate that they're going at, how much of a chance do they have of actually getting this under control in India, given the current situation that's going on?
Oh, it'll get under control. It's just a matter of how much time and how many people die, right? I mean, all these infections always burn themselves out at some frequency, but the cost of lives, and then the cost to their healthcare system, the cost to the people taking care of, like you were mentioning about this country and how lucky we were, whatever, with all these people that were infected.
Just for the past few months, that's all.
Yeah, I mean, that's true. I understand. But if you think about just the whole, all the different issues that was going on at the hospitals, they did a survey. It's something as crazy high as 1 in every 4 or 1 in every 3 healthcare workers are thinking about finding another profession and leaving the healthcare field or retiring or whatever the case is. Crazy high. They're just burnt out from dealing with. And in this country, it's a little bit worse too, because it's like, can you imagine if you were treating these people and they were basically yelling at you because you were telling them they had COVID and they were telling you that COVID doesn't exist, that they must have cancer or something. And it would be, I can't even imagine how would you go to work every day and deal with these issues and watching all these people die. And so so it's so even, I mean, we're getting very dark, but even when
that's what we do.
Even when a country does well, you still have a lot of people that end up really suffering, all even the ones that survive. And so the question was about getting out of this. I mean, I think it's going to be vaccines, and I think what you said in the beginning about getting the Johnson & Johnson and the AstraZeneca vaccines, getting them to India. India actually has vaccinated a lot of people. I was looking at the map. The number of people is quite high, but the percentage of people is 2%. Quite low.
It's like 2.1%.
Yeah, it's like 2. I think today was almost 3%. So, but it's a lot of people. But they have 1.3 billion people. So if you vaccinate 100,000 people, you still got a long ways to go. Right?
That's right. That's right.
We're all happy we got 100,000 people vaccinated. We're like, woohoo! And they're like,
exactly. 100,000 people. They're like, that's just my neighborhood. Like, what?
Yeah, no,
that's nothing.
I
mean, it's I was listening to this newscaster telling about this reporter in India, and she mentioned this really terrifying number. She said that in one of the poorest states in India, Bihar, they have one doctor, Don, for how many people, Don? 28,000 people. One doctor for every 28,000 people. What are the odds of these people surviving, getting vaccinated, getting tested? I mean, it just broke my heart when I was like, 28,000 people for one doctor? There's no fucking way the one doctor can manage that. There's just no way.
You can, and so you see the daunting task that government would have, right? So you saw the daunting task that our government had.
Yes.
And we're, supposedly a non-third world country. But,
yeah.
You can see, and there you have that kind of, so you would have to come up with a plan. You'd have to if you were that government, you'd have to think about how to get to those communities, who you were going to send, where you were going to get vaccine, how or treat them, and then how you would set up. You have to set up like these tents. And I just saw one thing where they were setting up like inside of it looked like where they play sports or a convention center or something, and they had cardboard beds made out of cardboard. Wow. And I suppose it's better than sleeping on the floor if you're sick, and then the doctors can more easily get access to you. But it doesn't seem like a good long-term plan.
I think what alarms me is how silent their government is throughout this, where they're not like, hey, we're going to get this under control. We're putting in all the resources. There is no conversation whatsoever. And it is simply, it's like, you're right. Even in America, we are a first world country. We are a superpower and a world power. And even for us, because we had bad leadership in place, right? And now that we have good leadership in place, it's still a daunting task. So even when you're doing everything right, it's still a daunting task versus when you're not doing anything. So a massive country like India, especially if you go to the rural parts of the country, right? Even people who are, like, for instance, in Maharashtra, which is what Mumbai is, they have 4.7 million cases. They recovered 4.04 million, and they have had 70,000 deaths, 70,851. Kerala is the next one, 1.6 million, which is in the south. Karnataka, Uttar Pradesh, 1.34 million. Tamil Nadu. I mean, the cases are high, man. They are very, very high. And they said at least one dose was given to at least 6.7% of the population. That's how many vaccinations. And you just kind of look at these numbers. Is that a world data? No, that's in India. That's 6.7%. Wow. 91 million people have been vaccinated, and that's 6.7% of the population.
That's such a daunting, it's just such a daunting task.
We didn't even have 91 million people vote in this country.
No, we had more than that. Remember, I think it was 77 million for one person and 78 million for, I don't remember. It was a bit more than that, but you're right. You got your basic issue. Yeah. It's crazy. And then did you hear about I was watching Fareed Zakaria. He was talking on CNN, and his mother had passed away, I think, or one of his parents from COVID. Yeah. And he was basically outlining, explaining what the government had done. And so, and you may know this, and I don't know if I'll just go through it really quickly. So the first thing they did back in, I guess April or May of last year, they did that 3-week shutdown where the Modi, is the prime minister? Is that what he is? He gets on TV and he basically, say again?
I said, sadly, that's him. Yes, that's him. Yeah.
So he gets on TV and he basically says, 3 weeks, nobody can leave their house. Everything is closed starting tonight. So people didn't know, they didn't know if they should leave the grocery stores open. They didn't know. So the pharmacies were shutting down. They just didn't know what to do. And so so it was a big, and then people started moving around so that they could get to wherever they needed to be, because there was these people that were out in the countryside, and then the trains weren't running or whatever. So they were walking places. It was like this huge mess. And so he was basically saying, because it was such a mess the first time, he goes, I don't even think they could. And so many people were hurt by it, either by food issues or just other issues, that he's like, I don't even think they could even do another shutdown. It's not even a thing that's even on the table for India. And it's just like
bad leadership. That's bad leadership, right?
Leadership. Terrible.
Yeah, horrible leader. I mean, how do you tell 1.8 billion people we're going to shut down starting tonight? There's no planning. You don't plan that stuff out. You don't say, hey, bring on all the experts in your government and be like, hey, how are we going to tackle this, right? How much time do we need? How much time do we give people to be able to go get their medication, grocery shoppings, whatever, right? That they have enough time, that they've loaded up on stuff, and they're like, okay, in a week and a half or in 2 weeks, we are going on a lockdown. You have 2 weeks to stock up, get your medication, get all your affairs in order. Okay, that's planning. Starting tonight, if they did that in America, people would take it to the streets. I can't even imagine, right? I mean, it's ridiculous.
I think you need a kind of an authoritarian kind of hand to do that, right? You would be like,
which
nobody can leave.
Very much is.
Nobody can leave, and then people are afraid that they're going to get arrested or whatever if they leave their homes, and then you create this huge problem just on all different levels. I was so surprised. And then the other thing they did wrong is they had this kind of thing going around like 3 months ago where they were calling the Indian people kind of like super resistors or something. I can't remember what word they were using. Like, because they had such a low level of infection in India, they thought that maybe Indian people in general were just more resistant to the virus. And so they started opening like everything up. Like they had the weddings, they had the whatever, just everything, just like normal. I don't know how many people wear masks. I don't know but they just started doing all these different things. Well, at a wedding, nobody wore a mask, I'm sure.
Right.
So, you can just imagine how crazy the whole, with all this stuff going on. And then the variants. So then the new variants come in from England or wherever, and they're the ones that are more easily transmitted, and they're the ones that start going through India. And that's the first step to, like, that's what changed probably. And then that changed, and they didn't adapt to it. They just left everything open.
I see.
Yeah.
So the variant came in from, so whatever strain was initially in India was not as strong, but then the one from England how many months ago did the strain from England came to India?
The English strain was started in the fall. I don't know when it got to India. I don't think anybody knows. I don't think they were looking very hard. I read a report. They were trying to, like, they have this idea of how many variants they wanted to sequence every day and to kind of get a sense of what was circulating. And they were way down. Like, instead of they wanted 5%, they wanted to sequence 5% of all the viruses that they had tested. Some number that was very high, it's a difficult thing to approach, but they didn't even come close. It was like they got 0.2% or something, like a very, very low number compared to what they were shooting for. And so they really don't know what's circulating, and I don't think they know what was circulating in September and October, November. I don't think anybody was testing.
Right.
We weren't testing. Honestly, we weren't doing a good job testing here either.
Listen, we had an orange buffoon who was our leader. So there's also that, right? Those are the things that we were going through. John, what do you see? I mean, if 20 million people are already infected in India, and their daily infectious rate is higher than ours, and we had the highest infection rate in the world, what are we looking at? 10,000 deaths a day in India? What are we looking at?
Oh, I don't know. Yeah, I mean, you said what was the death number for today? I know the infection number. I can
almost 4,000. It's 3,000. I'll tell you, 3,689, if I'm not mistaken. That was the number. 3,689. Yeah, that's correct.
So their peak was 3 days ago. I mean, I'm not saying that it's not going to go up again. I'm just saying they had a peak of 400,000 people being infected that they identified by testing in a single day. And they think so our testing didn't pick up everybody. And they think their testing is much worse than whatever we were doing. They think it could be 10 times higher. So that's up to 4 million people infected in a day. So forget about 4 million, even if it's 1 million people infected.
My stomach just turned when you said that.
It's 1 million people infected in a day. And if 2% of them die, it's just the numbers just get so just ridiculous.
Wow.
20,000 people a day, could be dying.
I'm just I'm just like trying to read these numbers, and they right now are confirming 222,000 confirmed coronavirus deaths. I personally think, Don, because there is no real way to track down the number of infectious cases and deaths, I think these numbers are inaccurate. What do you think?
Yeah, I think every country's numbers are going to be low. I think in a country that's with a healthcare system that's not state of the art. They have a decent healthcare system there, but it's not as good as other countries. Obviously, they have so many people, and they have slums that are so much worse than the slums of most other countries. That you're missing. You're definitely missing lots and lots of people.
Right.
So what is that? So what was the number? 220,000 deaths.
222,000.
Yeah. So we're at 5. So we have 580,000 deaths in this country. So you can see that number is much lower than ours, and it's partly due to the fact they had lower cases, but partly due to the fact that it's underreporting, I'm sure.
Right. They're talking about 57,000 were recorded just last month. 7,000 deaths just last month. So these are very alarming numbers. I guess my question to you is, how deadly is the mutated strain from Brazil versus the mutated strain in India?
So I don't know that anybody knows that. We haven't tested. Most of these viruses the new variants it's more about transmission. So you're asking me about deadly. So you're asking me when you ask me deadly, what I think is, if you get infected with this variant, what percentage chance are you of dying versus this other variant?
Yes.
And the data so far, it seems to indicate that the chance of dying for somebody, it's unclear about all ages. Let's not talk about ages. Let's just talk about in general, is relatively similar for different variants. What's very different is how easily the variant can go from you to me. And so if the variant is more easily transmitted from you to me, that means that, or you to, instead of going from one person, it's going to 10 people. And if it's still the same percentage people dying, more people are going to die, right?
Right.
Because more people are going to get infected. So that's the way we've been thinking about it so far, or the data supporting so far. It's not that they're more deadly, but I don't know. We don't really know about this new variant in India. Until people go and test it and look at it and isolate it, it's just guessing.
Right. James said they need to waive the vaccine copyrights temporarily until the world is vaccinated.
I heard they were doing that. But I don't know.
So what does that mean, Don? If a vaccine is copyrighted by Pfizer or Moderna or J&J, and they've waived the copyright, so what does that mean? That other local, they can manufacture it in India with the same formula, and they won't have to pay for the copyright? Is that it?
Yeah. So it's about manufacturing. Really, that's what that's all about. So, Moderna and Pfizer are just. I don't know that any factory in India is going to be able to easily make lots and lots of that. It's just a difficult vaccine to make, formulate, cold chain issues, store it. So really what you're talking about is really just you're talking about J&J and AstraZeneca. Right. And I heard that both of those were actually they were looking into how to produce more of it in India. And I think they moved past copyright issues into manufacturing issues.
Yeah. Wasn't Ocugen the biggest vaccine maker, and they were talking about being the largest COVID vaccine maker in the world? I heard, and it's an Indian company.
That doesn't surprise me. I do not know about that company.
So so J&J J&J comes out, and AstraZeneca says, all right, we waive our copyrights. Here you go, manufacturing companies. go ahead, make the vaccine. That also costs money. I mean, who's paying for that? Is the Indian government paying for that? Are the poor people paying for that who are dying and can't go to work and don't have jobs, like don't have any money in their pocket? Who's paying for it?
Yeah. That would have to be the government, right? I mean, that's the only, or the World Health Organization. I don't think there's anybody else that could even possibly come up with that kind of money.
Right. I mean, we're talking billions, right? We're talking billions of dollars.
I do not know, but certainly tens to hundreds of millions for sure.
Easy, right?
Easy, yeah.
I mean, Don, I did not know, but each COVID test that we were getting for free because we're U.S. citizens, it's like $100 a pop. It was like $100 for each COVID test that, of course, the government was picking up the tab. I actually had gotten sick the weekend of Thanksgiving and I freaked out and I was like, oh my God, did I freaking get COVID? Like I have fever, I have chills, like what the hell's going on? And I was freaking out. So I went to Cedars-Sinai and I was like, hey, can I do a test? And they were like, you can. It's going to cost $250. $250 for a COVID test.
And they just wanted you to go to one of the
yeah, because it was a Sunday. It was a Sunday, and the free testing places were closed.
Oh my God.
So I freaked out, and I went to Cedars, and they were like, "Yeah, $250 a test." I'm like,
when was that? November?
This is in November. I'm like,
That's
what a
crazy.
highway robbery! This is a highway robbery.
That is crazy. They should never have done that. That's exactly part of the problem, right? I mean, it's our healthcare system it has to make money.
That's right.
So it's pandemic or no pandemic, they got to still pay money.
Yep, and they were like, if you're not paying $250, can you please step aside? Because there are other people behind you who will pay $250 for a test. True story. Jesus. And I walked out, made an appointment the next day, went downtown to Union Station and got my test. You know, it was like lines out the door, people getting tested. But it's so horrific. This whole thing. Don, I look at somebody like New Zealand. I look at somebody like Australia. I mean, UK just did this test thing, this example thing, where they did a concert of 3,000 people this past weekend. But they made sure that everybody who came in had to prove that they were COVID negative. So now, of course, we're going to find out if there have been any breakouts or are there any breakouts? Did it work? This and that. Do you think is that something that we should try in America also as a way of testing to be like, hey, show us proof that you're vaccinated or you're COVID negative to see if we can really. I mean, I know that things are slowly opening back up. Like, for instance, Vegas is going to be fully open come June 1st, like full blown open. No social distancing, no mask mandate, like none of that stuff. How do you feel about that as a infectious disease expert when you hear something like that?
Well, people in Vegas, I mean, they're very responsible.
Listen, Don, what happens in Vegas comes home with you as COVID.
In Vegas stays in Vegas.
COVID in Vegas stays in Vegas, right? Sadly, that's not the case. We all know COVID follows you even from 7 seas across. So COVID is not leaving you behind. But how do you feel when you're just like, oh, we're not ready to do that? Like, how are you feeling about that?
I think what we're going to do is we're going to ask for vaccination records. I think that's what we're going to do. It's going to start with the universities. They've already started to announce it. The universities, if you want to start in the university in September, you need to either prove that you're vaccinated or prove that you can't be vaccinated for some reason. Okay. And then it's going to move to other things. You know, basically, it's the key to getting everything going, right? So it's going to just move to. You want to go to a concert, you want to go to work, you want to go into, I don't know, a sports thing. It'll be vaccinations and it won't be testing. Right. Testing might have worked before we had vaccines, but now it would be, you just require vaccines. And I think you're going to see more and more. Did you hear what the way Biden, he gave a short talk today about vaccine hesitancy and the steps they're going to take to try to address it? Did you hear it today?
No, I didn't.
Super interesting, because he talked for like a third of the time about the different incentives that they're going to come up with to get people to get vaccinated. Like if you go to a CVS, you get vaccinated and you get a 10% coupon to buy stuff. You get 10% off whatever you buy. And it's just kind of like, to me, it's just so kind of silly, because it's like you're getting vaccinated, you're getting a vaccine to keep you from getting sick.
You're gonna have freedom because of getting vaxxed. Hello.
Not like you're giving up. Well, there are side effects.
I thought he was gonna be like, you get a lollipop, and then I was like, okay, this is too much. This is too much.
No, they're giving away. One state wants to give away beer. I think it's New Jersey, actually.
I believe that. Anything, something like that out of Jersey, I believe it. Yeah.
You get a free beer. You get like a coupon for a free beer.
That sounds about right. That sounds like Jersey. Yeah.
I think that'll do it for Jersey.
I'm amazed that they're not giving out crack pipes, because that's something that I would expect out of New Jersey. But yeah.
That's a low blow, California. I don't know.
Hey, man, I went to high school in Jersey City. I can talk shit about Jersey.
Oh, Jersey City. Yeah. I live
there. Jersey, the Garden State Parkway. There is no garden in Jersey. Stop it. It's false advertisement. Anyways, I digress on Jersey.
Should we talk about Jersey tomatoes for a while? No, just kidding. Let's go back
there is nothing. Let me be clear. The only two good things that ever came out of Jersey, or three actually.
I bet we one of them.
Are you a New Jerseyan? Are you a Jersey guy? Okay, yeah. So the four, I guess. Don Sodora, Frank Sinatra, Bon Jovi, and Bruce Springsteen. That's it. Those are the only four good things that have come out of Jersey. Okay, that's it.
There's some good comedians out of Jersey. I mean,
really? Which ones?
I like Jon Stewart's from New Jersey. Jon Stewart, The Daily Show, so good. But okay,
sure, Don.
I'll just give a plug for somebody who's no longer doing comedy. Okay, go back to COVID. Go ahead. We don't want to go over our time. I'm sure people
we're
want to
good.
hear about COVID.
Andre said the best tool against anti-vaxxers is social consequences. You can't go to public places without a vaccination card. Listen, they're going to play their freedom card. They're going to say, oh, it's it's an infringement on my freedom, and this is a free country. What are we? I read some of the comments. Somebody's like, what are we, Russia now? That we're going to require people to show vaccination cards and negative COVID tests? No, they are not doing that in Russia, because if that was happening in Russia, then that would be a good thing, and we would love to copy that. But that is not what's happening. Yeah, that is not what's happening. Like the fact to compare it to communism or to compare it to somehow dictatorship, Don, what's wild to me is that pretty much every child in America got vaccinated growing up. We have no problem getting our children vaccinated, yet adults seem to forget that the reason we don't have smallpox, polio, all these horrific diseases is because of vaccine. What is going on with this mentality of, oh, I'm not getting vaccinated, and being proud about it? It's like, you're an idiot.
So there's a lot of different things going on in their minds, and so I've actually watched two different things on anti-vaxxers before the show, so I have a good sense. I can tell you that it's complicated what they're thinking, but a lot of them.
What are they thinking? They missed out on hugs. They missed out on hugs from their parents, so now they don't want to be vaccinated. What is so complicated? I'm trying to understand.
They see it. So people that are hesitant, vaccine hesitant, are hesitant for, like I said, a number of different reasons. And one of them has to do with this idea that it was rushed, the idea that it was politicians telling them to do it, the idea that, so one thing that comes across in all these different, when they talk to all the different groups, is that if their doctor, their own doctor, had a conversation with them about the vaccine and was offering the vaccine in their office, that would make a difference. So that's interesting, right? That's telling you that they're actually thinking it through, They not everybody, by the way. That's not everybody. That's just a proportion of them.
Yeah, we know Jenny McCarthy isn't on that train. Yeah,
I think didn't she change the anti-vax? Didn't she no longer I thought no, I don't remember.
Can we take the mic? Can we take the mic away from Jenny McCarthy because she needs to just stop?
I've heard her say other things in the past that were just terrible. I don't know what she is now though, but I think I think that's good, right? That's a good thing. So now we know we got to get the doctors that these people go to get their heart medicine. So the doctor says, "Here's some heart medicine, take it," and they're like, "Okay," and then they're like, "Here's a vaccine, you should take it," and then they're going to be like, "No, because some politician said to take it first." No, they might listen, right? It could happen.
Right.
That's the idea. That's one of the ideas. In addition to the 10% coupons and the free beers.
10% coupon. Yeah, that really is the incentive that gets me motivated to go to CVS and get myself jabbed. 10%, that's where it's at. At least it covers your tax, so that's comforting.
That's something.
It's something. Listen, it's something, I have a comment here from James made a really good comment here that I want to share. What is the James said he said that there is speculation that they are lowballing the number of deaths in India. The estimate is 10 times the official count, which I think you had just mentioned. He said the US and Europe are hesitating opening the patents due to huge lobbying effort by Big Pharma. Really? Is that a thing, Don? Do you think Big Pharma wants to prevent that?
I think they're past the copyright. I mean, I think that was a thing. I think it was like a thing months ago, but I think at this point they're past that. They know that they can't make enough vaccine for the whole world. I think that's a thing that they know, right? So,
wait, this is a joint effort by multiple.
James could be right, though. I mean, I don't know everything about what's going on, but if he's got some up to date data that says that the copyright is an issue right now. I remember hearing about it, and then I remember hearing that they had worked through it.
Yeah.
It's still there's a time difference, right? So that okay, we've worked through this now. Factories in India can start making the vaccine. That's still you have to still. There's a lot of work just to go to producing enough of it and then getting it in the bottles and then testing it and then getting it into people. There's still a big amount of time.
Right. The AstraZeneca vaccine. Can you store that at room temperature? Is that the deal with that?
I think it has a short. I don't remember. I think both AstraZeneca and J&J are both very similar vaccines, and they both have shelf lives in the fridge that is on the order of a week, maybe. I think Moderna. I think Pfizer you can't put in the fridge at all. Moderna is good for a day. AstraZeneca and J&J I think are good for a week. This gives you a sense of just how stable they are in a refrigerator, which is really important if you're going to be thinking about trying to get it to, developing countries and things like that, right?
Right.
Right. But I don't know if James knows that data too. No, I'm just kidding.
James is my Google researcher in the background. I pay James in empanadas, and that's what he does for me in the background. Michelle said, that is really interesting. I guess it seems obvious that if our doctors called us up and said, let's schedule the vaccine, we would be more likely want to do it. Why do you think that has not, why do you think the Biden administration is not coming out or even reaching out to all the doctors, be like, hey, call up your clients, you have their information, email them, call them, be like, hi, when are you coming in to schedule your vaccine?
So that's what he announced today. That's what I said.
Oh, yeah, that's what you know. I thought you just announced a 10% coupon. That's what.
No. That's the other incentive. There's two.
That's right? The other. Got it.
Thing. Yeah, no. So he announced today that he's going to be moving the vaccine into doctors' offices, so that people could go to their doctor to get a vaccine. And it would be covered by the government. It's free, still free. They don't have to go wait in line in their car or any other thing.
Right.
You could just go right into your doctor or to CVS if that's, you can just go right to your doctor. Yeah. And then you don't get 5G, though, if you go to your doctor. That's the only downside.
5G?
5G in vaccine. That's true.
Oh, you mean Bill Gates isn't chipping us when
Not if you go to your doctor. If you go to your home doctor, you don't get the chip.
You don't get chipped by Bill Gates. Don, I want to ask you: do you think coronavirus is going to be like the flu for the rest of our lives, like for all the coming generations from this point on? Like, because the shots are good for how long? 6 months, a little over 6 months. So then after that, we have to get what, boosters? We have to get pills. How does that work?
So they did a recent test. It was 8 months after people were vaccinated, and they still had lots and lots of antibodies. So that says that the shots will be good for at least a year, probably longer.
Okay.
Problem will be
all of them. J&J, Moderna.
They only tested Moderna. Like they only tested Moderna. So Moderna, Pfizer are probably in that category.
Okay.
So what is that? I just got a memo here. I got to read in a minute. So Moderna, Pfizer. What was I saying?
You were talking Moderna, Pfizer, their longevity, and do we need boosters after that? And pills.
Yeah, so they're probably. I mean, they're probably all good for a year or two, but there'll be new variants. Just like that's what happens with flu, right? You get a completely new variant comes around every year. That's why you need a new flu shot, not because your antibodies to the last year's flu shot went down, but because the variant that's coming around is different, and that could happen. That's probably what'll happen. I'm guessing.
So then after, I heard that Pfizer is actually coming up with a pill form where you can just pop the pill and it gives you immunity rather than getting jabbed. Did you hear about this?
No.
So I was reading this article and they're like, yeah, Pfizer is currently working on coming up with a pill that you can take. So after 1 year, if once the antibodies are declining in your body, you just pop a pill and,
It could be. I don't know. There's a lot of technology doing where you put vaccines and drugs and things in like different forms that go inside, like between your cheek and your, like where you put your tobacco. Where you put your tobacco.
Really? With my tobacco, yes.
But yeah, there's a lot of technology for that coming that people are working on where it gets kind of just dissolves through your mucous membranes in your cheek and your mouth. But it could be a pill too. I don't know. I did not hear that, so I can't.
Are we gonna need boosters after a year? So I got vaccinated in March.
My answer is I don't know.
How come? You said the antibodies are good for a year, and then what happens after that?
Because the variants. It'll be about the variants. It won't be about It won't have anything to do with your immune response. In my opinion, my guess, that it won't be your immune response that's waning. It'll be that the new variant comes around, and they'll be like, "Hey, there's a new variant come around, Mona. You need to get a booster because that you don't have the antibodies to protect you against the new variant." That's what's going to happen.
Got it. And well, I'm sure anti-vaxxers are going to love that. But so new variant comes along. Let's say a year from now, right? There's a new variant. Everybody who got vaxxed, go get your boosters. Shit, I gotta go get my booster. Oh yeah, but so I have a girlfriend. She has MS. She's had MS for about 10 years. She's immune compromised. She went and got Pfizer. It messed her up. Like it put her, because her immune system's already compromised. It put her out of commission for like almost a week. She was like, I'm out. And she's like, Mona, I am so scared to take the second dose that if the first dose did this to me, what is the second dose going to do? Then she got the second dose. She had symptoms for about a couple of days, and then she recovered. Right? It was better. Yeah, she got better. But then she was like, what's going to happen that if I have to keep taking these boosters and it keeps putting me out of commission? What happens to those people?
Yeah, it's so... These are tough questions, right? My wife and I, we have a friend who actually had a bad.
Oh, congrats! You got married during the pandemic.
I got married during the pandemic. Yeah, it's last time
good for you. Good for you.
So I think if you're one of these people, maybe the Moderna and Pfizer vaccines are not for you. Maybe there'll be a J&J version that'll be, I mean, there's a small issue with regard to potential clotting things, but I think they're working that out. I think next time it goes around, can you see my dog? Is that why you're smiling?
Yes.
I think he's not in the shot.
Dogs put a smile on my face. That's what they do.
So so I think Moderna and Pfizer might not be the vaccine when there's a booster in a year that your friend will take. But hopefully the new other vaccine won't have the same response.
Yeah. Are there like different kinds of Pfizer vaccines for children, for kids under the age of 15, or does everyone get the same kind of vaccine?
They're all going to get the same kind of vaccine.
So are children getting vaccinated? Do babies need to get vaccinated? Do toddlers and
they're going to get down? Yeah. So right now they've gone to 13, I think, or 12, I think, and they're gonna. Again, it was Biden's speech from today. If anybody wants to go back and watch it, it's a very short.
I'm gonna watch it after this. Yeah.
It's I think it's only like 10 minutes long. I think he says that they're going from 12 to 16 because I think 16 and over have been already approved, right? And so they're going to go from 12 to 16 next, and then they do like a step down. And we've got a congratulations from Michelle, Jody.
Yeah.
And they do like a step down, like they think, okay, 12 to 16, that's safe, and then they'll step down. And I believe they want to get down to 2 and over for the vaccination. Okay.
2 and over. Wow. Yeah. And it's the same. So there's not like a kiddie version of Pfizer or Moderna. It's like everybody's getting the same thing.
I don't know. They can give you less. They can give the babies less of a dose, though. They probably will check for that. And that might be good because the babies are little. A smaller dose might be just fine and might have fewer side effects.
Because they already have awesome immune systems.
Yeah.
Right. Their immune systems are fired. Right.
Unlike us old people.
Unlike us old people, unlike us people with knee and lower back problems. Yeah, people like us.
I have a memo I got to read. AstraZeneca can be stored at regular fridge temperatures for up to 6 months.
Oh wow, AstraZeneca and just your regular fridge.
Yeah, just like in your house fridge.
Okay, that's comforting. Did your wife provide you with that information?
Yes, that is a memo from my wife in her handwriting. Yes.
Thank you, Mrs. Sodora. Appreciate that. I appreciate that.
My name.
I appreciate that. Thank you, Jody. I appreciate it. Thank you very much, John. I'm not going to keep you any further. This has been a really lively and great conversation. What are you? What would be? Well, I've been sharing this place where people can go and donate money. Thank you to Don Sodora for sending me this link where people can go and donate. What is the number one thing? What would you say are the top 2 things the Indian government needs to do ASAP to get these numbers under control?
Jesus, pretty top 20 things, right?
Top 20. I'll make a concession. Top 2.
First thing they got to do is figure out how to get their hospitals working at some kind of a way it's not completely, they're not functioning right now. Like if you're sick in India,
you're screwed.
You're just forget about COVID. If you're sick of anything happens to you, I think
that's right. You get hit by a train or whatever. Yeah, you're screwed.
Yeah, they need oxygen. They need to get the hospitals working. That's got to be their number one criteria, number one thing. And they need to get help in there. They need to get supposedly people are sending aid, but how much aid would you need to send? For how many hospitals must they have? Oh my goodness.
Look, like I mentioned to you, in Bihar, they said there's 1 doctor for every 28,000 patients. 1 doctor, 28,000 patients.
That guy's busy. Or girl.
Guy or girl is not going home, and who knows? God forbid, they might end up getting COVID themselves if you're treating and getting exposed to that much, right? And then I wonder also, Don, if doctors are so overwhelmed, are doctors also getting infected? And then if doctors are dying or nurses are dying, then who's taking care of the sick?
Yeah. And how many are just not going to want to go to work, right? Because it's just too dangerous. But the vaccines, the nice thing about the vaccines, if you can vaccinate all your healthcare workers, and then the old people, and then like we did. It does provide a level of protection. It does provide a level of, okay, I'm vaccinated. I need to go work and take care of these sick people, but I probably won't get infected. I probably won't get sick. I'll likely be fine. So the vaccine is important. So that's the second thing is the vaccine. I would say get your hospitals working and get vaccine to as many people as you can, as fast as you can.
Right. Just start jabbing people. Find them, just jab them. Be like, here you go. Just jab,
Jab them. How hard could that be?
How hard could that be? Exactly. How hard could that be? Well, this has been
track of them too, right? We probably need, just like we do, they need to keep track of the people and who they jab and where.
How do you keep track with 1.8 billion people? How do you keep track, John?
It's 1.3 billion people, though.
1.3. 1.3.
It's easier.
It's a little easier. 1.3 billion. But I also think about neighboring Pakistan, neighboring Bangladesh. How bad are the cases there? My mom is in Pakistan right now, and I was like, Ma, like, do you go out? She's like, people are so severely traumatized. She's like, that nobody steps out. It's like all the roads and the streets look haunted. They look haunted. Nobody's out in the streets. She's like, people are absolutely petrified of going out. They don't know the numbers. The government doesn't really have any way to track it down. If they can't even track the numbers down in urban areas, how the hell are they going to track down numbers in rural areas? They can't. They don't have the resources, right? This is all very, very sad, Don, but thank you very much for your brilliant input as always. This has been great. Dorothy said, great show, Mona. He's very smart. Yes, he is, which is why we keep inviting Don Sodora back.
It's his mom.
That is the most mom thing ever. I'm going to put this up. That is the most mom thing ever. Thank you, Dorothy. Thank you. This is adorable. I got to blast this. This is so sweet. No wonder she's like, he's very smart. I made that. He's very smart. That's my creation. Aw. James said, thanks, Mona and Don. Fascinating chat. And Michelle said, thank you both. You are both brilliant and informative. Thank you very much. That's very kind. And Dorothy is so sweet, and she sent us a heart. Thank you, Dorothy. We send you a heart back, too. Thank you very much. Thank you for creating Don Sodora. So I appreciate that. So he can be on our show today. Don, you're awesome. Thank you very much. We'll bring you back on again, but this has been such a great conversation. So thank you.
Okay. Nice seeing you again, Mona.
Nice seeing you. Take care.
Thank you.
That was the amazing Don Sodora. What a great informative chat and a fascinating chat. You guys, if you haven't subscribed to my YouTube channel, please do. You can go to youtube.com/Mona Sheikh and the word comedian. That's my full name and the word comedian. Same name on TikTok, same name on Facebook. And you can follow me on Instagram and Twitter at Mona's Comedy. I will see you tomorrow with a brand new guest. Have a good evening. Stay safe out there. Get your vaccination, please.